Hey everyone, it's Bill from CamboDiA. I've been asked a few times to cover healthcare and medical issues in Cambodia, so that's what I'm going to do. Now, I'm going to say right up front, this is not something I have a whole lot of expertise with because I never had to go to a doctor or a hospital when I was in Cambodia last time. And so I have found out about a few places that are reputable that I will link down to in the description, and I will credit For Real, that channel, for providing that information, and share a link to their video as well if you want more information about those specific spots. What I can tell you is there are no such thing as prescriptions in Cambodia. You can go to any pharmacy and get meds, and they're generally pretty cheap, and you don't need a prescription. There's nothing illegal or underhanded about that. It's just literally the way it is. I got diabetes meds when I was there last time. One of my old videos talks about that. But basically, yeah, you can get what you want there. The meds generally come from France, and they're decent quality. Some of them may have different names than you're used to, so you may have to look those up. But I didn't find it very difficult at all to get those. And I will also link to some good pharmacies in Siem Reap, because there's a few shady ones that will try to sell fake pills, but it's not really common. You may hear about that happening, but it's pretty rare. So I'll share some places where you won't have to worry about that. As far as medical insurance goes, for me, it's prohibitively expensive because I'm 54 years old, and travel insurance is cheap, but it only covers so much, and you can only use it for so long. If you're an expat, you need expat medical insurance. For me, at the low end, at my age, it's like $300 a month for like a low grade insurance. If I wanted something decent, it would be $500 or more. And I mean, that's 2 or 3 times what my rent is going to be. So it's just kind of ridiculous. Kind of like in the United States, you have to have money if you really want to get good treatment. So I'm going to set aside a nest egg of a few $1,000s and save it up over time while I'm there, and just put that away. And if anything happens, I'll go to one of the reputable places I found out about. And if it's something really serious, I'll go to Bangkok, and it'll still be cheaper than in America. Health care in Cambodia is not known for its quality, unfortunately. Like I said, there's a couple of reputable places you can go to that will take care of you. But overall, you don't want to just go into any place, and you're not going to be able to expect the same level of care that you might back where you come from. That's just the truth. Healthcare in Cambodia is just not known for being good. And it sucks that it's like that. Unfortunately, because there's not as much focus on education as there really could be, people go out of Cambodia, like young Cambodians, they go out of Cambodia to get that kind of training, and then they generally go to where the better paying jobs are, which is not in Cambodia. So yeah, the healthcare is suffering, but it is slowly starting to see some improvement. So that's the first part of this video. That's about as much as I know on that side of the medical stuff. Otherwise, for the second half, I have some preventative tips to just help you so you won't need to get as much care. Or maybe you can prevent some serious issues. The very first thing I would say is there's these little electrolyte packets called Royal D that you can find at all these little shops. Mix that in some water once a day and have a glass of that. Because of how hot it is and how much you'll sweat, you need to keep electrolytes going. You need to be careful, keep yourself hydrated, and those will really help. Those are a godsend for expats. Of course, drink a lot of water, stay hydrated, wear sunscreen, because the sun is harsh, and you may want to limit the time you're in the sun out there, especially your first few months, because when I was there last time, I did end up getting some heat rash for a few days, and I was just exhausted, and I was just overdoing it. So take care of yourself and be careful in that way. Also, wear mosquito repellent, and it has to have DEET in it. I know there are people who don't like to use DEET, and I know a lot of it smells funny and all of that, and people have other reasons for that. But here's the thing, the mosquitoes are tough in Cambodia. They bite during the day and the night, and you can get dengue fever and malaria. You can choose DEET or dengue. I mean, the DEET stuff, it definitely works. There's other ones without DEET that smell nicer, but they're not as effective, really. If you ever get canned drinks, rinse them off, wipe them off, get them clean, and preferably use a straw, because a lot of these canned drinks, you know, they're stored in warehouses where there's rodents and they poop around on the pallets and things like that. So I learned the hard way. Like my first few weeks there, I was like having a lot of stomach troubles. And once I started wiping off the cans and like rinsing them off and washing them, that pretty much went away. So do that. Buy bottled water. I wouldn't suggest buying all the little bottles and creating a lot of waste, because Cambodia does have a trash problem that way. But there's these big blue bottles that you can get, and I think it's like a couple bucks to get the first one, and then something like 75 cents each time you refill it. And so you can just grab that thing, get on a Pass app or Grab, and you know, go to the local little water refill place and then take that back home. It's a cheap way to get clean water. As far as like food poisoning, most of the street food places are quite safe. I would recommend street food over restaurants, mainly because, especially Western restaurants, because they have refrigeration. They keep food longer than they should a lot of the time. And street food doesn't have time to go bad. And my secret is just basically look out at places where locals are eating. If you see a bunch of locals eating at a little street food place, well, then you know it's good. If nobody's eating there, there's probably a reason. That's as much as I can think of for medical stuff all around and preventative stuff all around. I hope this helps. If you have any other questions, certainly ask, and I'll do what I can for you. So thank you. Like and subscribe if you'd be so kind, and take care.